My name is Art Schwartz. I'm a Canadian citizen, permanently residing in the U.S. And I came to the U.S. because I married this wonderful girl from Virginia in 1996. We lived 10 years in Canada, and then we moved to Greenville in 2006. Unfortunately, she passed away about 6 weeks ago. But my background is I'm ex-military. I was in the aerospace business. Suzette was also an Army brat, so we were well-traveled, both of us. I had been to Open Arms Hospice before. I'm a member of St. Anthony of Padua Catholic Church Parish, and I play an instrument in the choir. And we occasionally come down here to play for the patients here. So I had been here twice probably in the last 12 months. So I was certainly aware of the facility. My wife's condition deteriorated in May, and we went from quality of life preservation to palliative care from the oncology people. And it was clear that this palliative care was going to wind up with death. In June, I believe, or late May, because frankly, the workload on me as a caregiver, and this had been going on since last June, was just becoming onerous because it was a continuous requirement. I knew about Open Arms because, as I said before, I had actually been here to entertain, and we were in the Bon Secours medical system at the time. We're Catholics, we're kind of pro-Franciscans and so on. So I was aware that Open Arms had a connection with Bon Secours. So when a decision was made to choose a hospice, it was essentially academic. It was going to be Bon Secours or Open Arms, McCall Open Arms. I refer to it as Open Arms. I know it's a combination, I believe, of McCall and Bon Secours. But that's how the decision was made. And the other way to put it is I didn't consider any other facility because I was aware of this facility. I knew how nice it was and so on. I came down here about a week ago to sort of close my acquaintance with the staff that had helped me so much. And I didn't want to overstate the case, but in a terrible situation that I consider the last year was, this was actually the best part of it. Because once the Open Arms Hospice people met with us, a weight was lifted off my shoulders, and I felt like I wasn't by myself anymore. And the quality of the care, well, you just couldn't beat it. Whatever was needed was done. It was as simple as that. And I put that in the context of, I always said, the medical people want to cure the disease. The hospice people want to cure the patient or help the patient and the caregiver. So it was really the people from Open Arms addressed me as much as they addressed my wife throughout the whole process. And that was a beautiful thing. Initially, we were having 2 visits a week from the nurse, and the nurse assistant was coming virtually every 2 days for bathing and care and attention to my wife. And the nurse was always available on call, and they were always within 60 minutes or so of the house. And if you wanted it that quickly, and normally you did. The doctor came once, I think, and that was about a third of the way into the process to establish the protocols for the drugs and so on, and checked over my wife. Social worker came once again, and the nursing frequency went up to about every 2 to 3 days near the end, and pretty well that was the frequency of occurrence. Now, I was very religious about documenting the drug protocols, the timing, and the schedule, so I had, compared to some, as I understand, I had a pretty good grip on it. And I had no hesitation about administering an analgesic if she started to hurt. We had the rule, no pain, no nausea. Those were the 2 rules. And Suzette understood this well, too, and she would say, I've got to have the Ativan, or I've got to have the morphine, whatever. She was very much in the process. So that I think, reduced the demand that we put on the folks. And I never felt that I was alone. That was the key point. That it wasn't a scoreboard thing. You know, how many times did the nurse come this week? The question was the nurse there when I needed her? The answer was yes. And the same with the CNAs were fantastic. These are the assistants who did the bathing and so on. Very, very attentive to Suzette as well. It was never looked at by me or my wife or the staff as a death experience. It was looked at as a life experience. And the staff and I agreed that her life was to have as much quality as it could in its remaining time. But we're not going to use the word death, we're going to use the word life. So that's how we sustain. The difficulty with dying is not the patient, it's the survivor. Because you're still around to think about it. We don't know. Well, we have faith that she's somewhere else, of course. But the issue is we want the patient to be comfortable and happy and sustained until. Simple.